I would like to call on Luana Pereira, is a registered social worker and an experienced psychotherapist in the Peter Gilligan Center for Women's Cancers at Women's College Hospital. She specializes in psychotherapy, oncology, and provides support to newly diagnosed breast cancer patients, cancer survivors, and genetic mutation carriers, such as those who are at risk for developing breast or ovarian cancer. Our presentation is titled Psychosocial Aspects of Breast Reconstruction. Please welcome Luana.
Hi, good evening. I'm really happy to be here and see some familiar faces. And I will talk a little bit about the psychosocial aspects of breast reconstruction, if I know how to work. All right. So just a little bit of an overview. We know that the breast is associated with aspects of femininity, sexuality, and motherhood. And the body image is really a mix of perceptions, thoughts, feelings, and the individual experience. And so breast reconstruction potentially can help restoring self-image after breast surgery. We do know from research that there's mixed results in terms of psychological outcomes related to different surgeries. So that means that there's no one size that fits all, right? So it speaks to how personal this decision is. Also, we've seen that overall coping can really improve within the first year after surgery, and again, regardless of what type of surgery. So it is expected to have a period of adjustment after surgery. And in terms of decision-making, many things can contribute to different decisions, but we do know that most important is to make an informed decision. And so, first of all, in terms of decision-making, making sure that you have all the information available. And I know that's probably one of the reasons or the biggest reason you're here tonight, so that's really good. We also know that perceived support, so if you feel supported by family and friends, that makes things a bit easier. Navigating decisions, and also making sure that you're balancing risks and benefits for you in different types of procedures or when to have your procedure if you're having prophylactic surgeries. Taking time to really reflect on your personal values, the relationship that you have with your body, and the hopes that you have for surgery too. And maybe questioning how a body image is presented to us by society. And by that, I mean maybe noticing if there's expectations or assumptions that comes for others or even for yourself that could be potentially getting in the way of you finding a good option for you. And so I would really encourage you to explore all options available for you. Maybe there are options you haven't explored quite yet. Ask all the questions as many times as you need as you process information that's given to you. Share your priorities and your worries with your healthcare team. Connect with people with lived experience, so connecting with people who have been through it before or who are going through it right now. And again, you have the opportunity to do that here today. And take a moment to slow down and really consider what is your priority and consider for your lifestyle what would be the best option for you. And access supports along the way. So psychosocial supports could be available for you through the hospital or in the community, not only to help with decision-making, but also to prepare and to recover from surgery. So for emotional considerations, we know there's a lot of stress associated with decision-making. So both for mutation carriers and breast cancer patients have to navigate many different hard decisions. So we know that this can really take a toll on coping. Grief could also be part of it, could be associated with many changes, many losses connected to that experience. So changes in your identity, changes in body image, body function, loss of ability to breastfeed, changes in intimacy, changes in your health in general. And then, of course, adjusting, right, to your new body image after surgery. So Ask what to expect around surgery and around outcomes, to have realistic expectations, looking at pictures, for example, and be prepared as much as you can be. And like I said before, it is a process, so be kind to yourself. Remember that it can take some time. Maybe also finding ways to reconnect with your body after surgery. So that could be looking, feeling, moving your body. Remind yourself to have, when possible, open communication with family members, loved ones, healthcare team, as you navigate changes, right, to address your needs. And the old and good, engage in self-care and self-compassion. So self-compassion, I want to highlight the avoiding the shoulds. I usually tell my patients that the shoulds are a big red flag. So if you're telling yourself, I should be feeling this way, or I should be doing that, just pay attention and see if there's a kinder way or more helpful way to approach that situation. And for self-care, it can be quite personal, whatever works for you, but these are some of the suggestions that we know that really help boosting resilience and improving well-being. So just making time for exercising, relaxation techniques, yoga, meditation, being creative, so it could be journaling, arts and crafts, spending time with loved ones, connecting with spirituality, faith, and connecting with others. And the psychotherapy could be, again, available for you at the hospital or in the community. And so there are many resources available for you as well. So a couple that I want to highlight for mutation carers is our Spark group. So we have a group that runs every month online that's led by peers who are trained by the Canadian Cancer Society. And these are available for anyone with a mutation that makes them at a higher risk of developing breast or ovarian cancer. And you can register with the email. And there's also the website Force that's based in the US, but there's a lot of information and opportunities to connect as well. And then anyone with the breast cancer diagnosis can also access supports with Gilda's Club, Canadian Cancer Society, Rethink Breast Cancer, YAC, Pink Pearl, Wellspring, and more. So I do have a handout with resources in my table if you want to take that home with you. And you can always ask people who are online, you can ask for a copy too. So just to sum up, as it's been said before many times, breast reconstruction is really a personal choice. So remember to get all the information that's available for you. Make sure that you're taking care of yourself on the way and engaging in reflection and accessing practical emotional supports that are available. Thank you.